Welcome back. Today we have a number 12. It is a broken tooth that got texted to me yesterday. So one of my endodontist friends slid into my DMs and he was like, "Hey, buddy, I got a tooth on a patient. It's broken and he needs it fixed as soon as possible." So no problem. Send him my way. So we showed up in the chair. I will show you what the pre-op looks like after my endodontist friend did the root canal. Here it is. So this is after he's received a root canal. You can see that's got Cabot temporary material in that tooth. And it is ready for us to do our crown prep on. So I really don't even need to trim this model, really, because it's just our pre-operative. So we're going to leave that alone. We'll look at our crown prep, which is right here. So here's our crown prep on that tooth. Got nice even margins all the way around. Axial wall, it's at least 2 millimeters in height. So we're clear there for bonding and retention of our crown. So let's start by trimming our model. And I can tell you a story about how I learned to do CEREC. So I went to dental school at Louisville. I graduated in 2017. We learned how to do porcelain fused metal crowns there. We learned in theory what zirconia crowns and Emax crowns were. We were not allowed to prep for zirconia. Still couldn't tell you why. I showed up to Fort Eustis on day one, and Colonel walked up and said, handed me the scanner and said, "Welcome to Fort Eustis, son. Have you ever scanned before?" I said, "No, sir, I have not." He said, "Well, this is an Omnicam at the time." That's what he handed me. "So this is going to be your new best friend for 4 years. We fix teeth the same day, so soldiers can deploy tomorrow." I said, "Yes, sir. Let's learn." And that's how I learned how to do all this. I was in the U.S. Army. So let's draw our margin. We're going to start with just a circle around the tooth. Don't really care where that line goes. We're going to follow it a second time. We'll trace that margin, and now we do care where the margin goes. So we're just going to make it nice and flush. This is where his tooth will stop and my crown will begin. And you might be looking at the lingual margin and thinking, "Dr. Rich, why did you not drop that?" Well, I like a hygienic margin. If it's above the gum line, it's easy to clean. I don't need much tooth structure to bond to. As long as I've got 2 millimeters circumferentially, I'm a happy dentist. That is what the textbook would tell you that you want feral ones. So we are good there. Also, concerns with this tooth fracturing. So by leaving more tooth structure, we're also helping to prevent fracture. Because what do we know is underneath the square buildup is a hollowed out nerve canal from that root canal. So by leaving the cervical portion, we're actually strengthening the neck of the tooth. Do I need to fix this? Probably not, but I'm going to do it anyway. Okay, margin looks good. Insertion axis, we're going to parallel with the long axis of the neighboring tooth. Right, like that looks good. Now, obviously, we're not going to close this distal contact. It's much too far. We are certainly interested in closing the mesial contact with this canine. So that's what we're going to aim for. That will work. Spacer, I like 120 microns. 120 microns is going to allow me to bond. Don't need to check positioning. We're just going to go straight into our proposal. So let's see what InLab gives us as a starting point. There we go. So we can look pre-operatively and see that lingual cusp matches mostly the same. Of course, the buccal cusp was destroyed pre-operatively, so not going to have much to go on there. But let's remove this, go through FOCC. So fissure height is more than adequate. We only need 0.6. We have more than that. Occlusion is a little bit light. We're going to add just a touch right here. I like that double turquoise. Go. Good. It's got nice 3 points of contact. I may bring this one up just a touch. There we go. It's got a little bit more contact there. Okay. First C is contour. So do we love the contour of our tooth? I think it looks fine. Preoperatively. If anything, it will be easier to keep clean than his pre-op. So we can look at the pre-op. So preoperatively, tooth is broken, not a super fair assessment, but our crown comes out a little more there. Our crown's going to help keep food out just a touch more, which will make it easier for him to maintain. So contour looks great. Contacts, we're going to remove the other teeth. We're going to examine our contact. Now, this red is all gum tissue contact. I'm not concerned with that. This green is what I'm looking for. So we've got double turquoise with a nice green proximal contact. That's what I like to see. I may bring a smooth tool in here and see if I can get some separation between the contact and the gingiva, which I've just done. It's much better. I'm happier with that. So gum tissue, that's going to move out of the way for me. That doesn't bother me. Okay, let's see about the length of our buccal cusp. So I know I said we were done with contour, but what does this tooth look like on the other side? I wonder if we put up a grid and we see him. So let's line up his centrals first. Make sure his laterals are lined up. Yep. Canines, tilt him down just a bit. So centrals, laterals, canines, touching that line about the same time. What about our, so I may make this cusp a little bit longer. Let's see what we can do for him. It's going to come into the shape, anatomical, and bring that down some. Now we'll check our excursive movements here in a moment. And of course, that's going to mess up our occlusion, but we'll fix that. So we want him, when he smiles, we want him to feel like he has a tooth there. We want it to be a little shrimpy thing. So we can see on this side, his first premolar is a touch, just a little bit shorter than that canine. And on this side, that looks about the same. So let's see if he is better on our grid. Centrals, laterals, canines. Yeah, that's better. So now his bicuspids are going to be about equal length on both sides. So that looks better. Are his canines perfectly level? No, I don't think so. But you know, he's got a couple of occlusal problems. That's okay. We're going to make it look good anyway. Grid is gone. Let's fix this occlusion. So we're going to put the lower arch back on and use a form remove tool to get rid of that yellow, green, and red. That goes away. The contact goes away. The height of that cusp will stay. There we go. That looks better. What happens when his jaw slides around? Let's find out. We're going to run the algorithm of him moving left, right, forward, and back. Let's see what it shows us. Looks like we've given him a little bit of an interference. So we're going to fix that with our form remove tool, getting rid of that and this cusp tip. So we were just a little too generous there with that cusp position. Let's take that away. That looks better. So now when he moves left, right, forward, and back, he shouldn't bump into that. Check our proximal contact one more time, just to make sure. And this is a finished product. Okay. This is why I love CEREC, because I can fix your tooth today and you get on a plane tomorrow. He's not going to have any problems.